He hasn't shine there, my friends, and welcome to the I Give a Damn podcast, made possible by Fluorescene Media, the company behind Odie's on Facebook. Today, we're going to be talking all about advocacy, passion, and politics with our guest, Dr. Dorothy Hitchmoth. If you're unfamiliar with Dr. Hitchmoth, she retired as the chief of optometry from the New England VA Medical Hospital in 2018. She's a private practice owner, an entrepreneur, and is often referred to as America's eye doctor. She's also been heavily involved in government policy as well as health insurance regulation throughout her career. In today's episode, we talk about how she got involved in politics as an advocate for patient care, as well as the profession of optometry. We then discuss how she views optometry as a key part of our overall health, as well as the healthcare industry in general. And then we even dive deeper to better understand her motivations into being an entrepreneur and being such a strong patient advocate. Dr. Hitchmoth is just an incredible person and speaks with such passion that I know everybody listening will find something to connect with. So please hit that subscribe and follow buttons and join me in this conversation with Dr. Dorothy Hitchmoth. Dorothy, welcome to the podcast. A huge honor to have you here. Thank you just for taking some time and sharing your wealth of knowledge with us.
Yeah, I'm happy to be here. I'm excited that you are taking so much effort in spreading the word and educating the public about how to take care of their health, how to take care of their eyeballs. That's a novel thing, and that's inspiring me. It gives me hope.
Thank you.
I see other people advocating for patients.
And that's something you've been doing your whole career as well. It's a big thing that drives you. So to get more into it, just to kind of introduce, have our viewers, our listeners who maybe have not gotten to know you, but can you give us a little bit more of who you are, your background, of course where you currently practice, but just a little bit more of your history, your quick 2-minute CV.
Yeah. So, I had the privilege and benefit of being in hospital-based academic practice, primarily the VA, for 22 years. I was insane enough to also have a private practice and engage in consulting for most of that time. I am in private practice now. I own a multi-specialty, all-medical private practice in the rural Outer Banks. Rural healthcare has really been my focus. So I feel that when you're in rural practice, things happen in a much more dramatic way. And if you don't make quick corrections, or if you're not paying attention, your patients will suffer quicker. For example, right now we have an enormous, doctor shortage, right? I was just asked to write an article. And of course, that's another thing that I do is I'm asked to write. I've written, published, books, scientific papers. I like to focus on editorial now so that I can share my knowledge and perspective with people like you and other people coming into the profession. Hopefully, maybe give a little sparkle of inspiration. I was just asked to talk about the physician shortage, the doctor shortage in the United States. Not that we don't have one globally, but the doctor shortage in the United States and how I think that's going to affect optometry and ophthalmology. And I'm like, oh, well, yeah, I can answer that question. I'll tell you how it's affecting us, because in the rural Outer Banks, things happen first. Collapses happen first. And we're in a crisis mode. I think you'll hear other doctors say, it's pretty tough. I'm triaging everything. I'm triaging headaches and vertigo and sinus infections and everything that can create eye symptoms, or that people think are because of their eyes or related to their eyes, showing up in my office. My office is across the driveway from an emergency room, and I
imagine they refer to you quite often.
all the time.
Because they don't know. They see the eye, they're like, I don't know what's going on.
Yeah. It's one of those things. So I taught at Dartmouth Medical School for a couple decades, and also taught optometry students and residents too, concurrently in the same clinic. And the medical students, they only get a little bit of experience in eye care. I mean, just like the rest of us, they know the anatomy, they know the diseases, they know how to triage, but they don't get a lot of practical hands-on. And so they really rely on optometry and ophthalmology.
Yeah, unless they go through an ophthalmology rotation.
Correct.
They barely scratch the surface.
Correct.
I have a good friend from college who's now a family doctor, and she's like, no, I had a chapter in eye care.
That's right.
And she's just family med, so she'll occasionally still text me and be like, hey, I have this case with this kid, what do you think? And it's a little bit humbling, I think.
Yeah. It is.
It changes your perspective of like where my skill set and knowledge really exist in the wide scope of what all of healthcare medicine is.
Yeah, that's a really important point. I think, first of all, let me just say this. I think eye docs, specifically optometrists, your family eye doctor, I think are the nicest people I know. I say this all the time. I just think that certain people choose to take care of the special senses, and vision is clearly one of those most precious.
It is one of the most amazing gifts, I think, that we have. I was just walking down the street here in New York, and just appreciating just the beauty of the gift of eyesight, the fact that I could see the cars driving by, I could see the people, the faces of people walking by, I could see, not just smell amazing food, but I could see it.
Yeah.
Like, I was just appreciating that gift that I have my eyesight, as good of eyesight as I do at this time.
Exactly. And, it's so cliche, but I say all the time, we help people see better every day, and we preserve vision. We improve quality of life. We tell people about things that they would not know about. People show up and see us when they don't see primary care or when they don't get regular medical care. I think most people think, oh, eye doctor, glasses. And that's true, and that's awesome. But it's eye doctor save life, eye doctor detect diabetes, it's eye doctor talk about nutrition, it's eye doctor, wait a minute, you're sending me for a cardiology workup? You're the eye doctor, right? And, we've all had those experiences and conversations. But when you're young and healthy, and for most of your life, which is a total gift, right? You think eye doctor, eyeglasses, and that's a great thing if that's been your experience. But our experience on the other side is very different.
Right. It's really the tip of the iceberg. It's just I sometimes will describe it like, to an auto mechanic, an oil change is not a difficult thing. Whatever you get at Jiffy Lube as an oil change is and the reality is we know how to take apart the engine and rebuild it. Like, it's asking like a NASCAR level, like auto mechanic to just do an oil change. And so it's an important part.
Yeah.
And we're really good at it.
Exactly.
But there's so much more that we do.
Yeah. And, you asked me, and I sort of, because I love to talk about, what's been my trajectory, what's been my experience in the profession. And I pretty quickly, I would say very early on, realized, oh my God, I'm a patient advocate. That's a real gift, right? It's a privilege to be a doctor. It's a gift to have that spark that says, oh my God, I can advocate for other people. I can help other people. And, for extroverts and certain types, that's inspiring on its own. And I always keep this one quote in my head from the famous Dr. Paul Farmer, who gave his entire life to taking care of patients in third world countries. And he said, I feel most alive when I'm helping people. And his words just ring in my head over and over and over again. And I'm like, yeah, I totally get that. I get energy from people, but I feel most alive when I'm helping people. And so that's been my whole career. Whether it's been I'm still very heavily involved on the political side in Washington, D.C., at the state level.
Yeah, I'm fascinated to hear your kind of what you've been involved in, what you've seen, because I don't know a single optometrist who, when they went into this profession, when they went to school, knew how much politics play a role in what we do and how involved we are with politics. And so many people are like, I wish I would have known this. Why didn't anyone tell me? So if you don't mind, let's just switch gears a little bit. Tell us kind of how you've been involved. How did you get involved in the world of politics? Hey, I just want to take a quick pause and give a shout out to Fluorescene Media. Not only do they make this podcast possible, but they are the company behind the social media community ODs on Facebook, which is the longest running optometric community with the most active discussions amongst over 46,000 eye care professionals. So, if you're not already a member, don't miss out and join the discussion over on ODs on Facebook. Otherwise, let's get back to it. And kind of some of your experiences that you've gone through.
Yeah, and I feel some, friction in your voice when you talk about that. And let me tell you, that's how it started. I was pissed. I was really mad. So, this is, serendipitous, I suppose. But when I was 15 or 16, one of my uncles ran for the state house. And I was on his political campaign and he won. And I'm like, oh my God, this is so exciting. This is a party, right? And so, when you're on the winning team, everything is exciting. But then I was on subsequent campaigns. He was at the State House. I went to pre-med, finished that. He was still in the State House. And then I went to NECO in Boston. And I was at a meeting one day and someone said, oh, we have this stuff we have to do in Washington and politics and blah, blah. And I'm like, really? And I was annoyed that we had to go explain the fact that we were doctors, basically, and that we had a quasi-limited scope of practice, even though we had all this amazing training for purely political reasons, because of, in my opinion, money and turf battles. I'm like, oh, I'll have none of this. A lot of ego. Yeah. I'm like, I will have none of this. And I'm like, sign me up. And so I went to Washington and I was part of the AOA Political Action Committee team that went from NECO. And I went as a part of, it's somebody with political experience, which I thought was really funny. But I knew how to navigate the scene. I understood, the sausage making. I understood how bills passed. I understood the relationships you needed to have. And then for the rest of my career, I was involved in AOA leadership on the advocacy team.
Amazing.
Yeah.
I'm just starting to get involved.
Yeah.
I've known about the importance of being involved because I had mentors who were, and they kind of told me early on, no, this is a huge part of what we do in our profession. But I've just volunteered, what can I do? What else can I do? How do I get involved? And so now I'm sitting as a volunteer on a committee for the AOA, and I'm seeing how I can help. Yeah.
In the beginning you learn, right? And so what I find is that people that are inspired and that care, initially you learn, but you're learning from the best of the best. So again, just another thing that happened. I'm like, oh my God. So I'm here, sitting here at the birth of my career as an OD with all these amazing leaders. How lucky am I? And thinking back, I realize that I think even more than I did at the time. I'm like, wow, this is pretty awesome. And I'm going to learn some stuff. And I did. And I sat and I listened and I learned. And now, fast forward all these years and, being the lead testifier in all kinds of scope battles, being the person that helps, pass bills in Washington along with a large team, to mentoring younger docs in my state to move that ball forward, right? We just had a big effort, and I did go down and testify, but I was flanked by a team of young docs. That was inspiring. I'm like, yay, this is awesome. Go for it, guys and gals. And, it was kind of crazy, but for some reason in the law, outdated stuff, we weren't able to give vaccinations. I joined the Medical Reserve Corps when COVID happened. I'm like, okay, here I am. I'm a doc. What can I do?
Yeah.
And again, patient advocacy. And I signed up and I'm like, oh, this is a little weird that they're, I'm like, I'll do anything. I'll direct traffic. Tell me what to do, whatever is needed. This is all hands on deck, especially in the beginning. We didn't really know how things were going to go. But I discovered there were some limitations. And so we've just now recently eliminated some of those artificial barriers to being a core part of the medical team.
I love the word that you put in there, artificial.
Yeah.
Because it really, I think, comes down to poor understanding of our training and really just a public view stance of what we do.
Right.
And so that's one of the things I think is just the point of advocacy, of understanding or vocalizing our worth, our skill set, how we help, how we're available to other people. So that's huge.
Yeah, and I think in our communities, because diversity, equity, inclusion is the vernacular today. But because we're embedded in so many communities, we know our patients better than anybody. We're just like primary care. Primary care, they know so-and-so and so-and-so and the brother and the sister. We have those experiences in our practices because we're so embedded. And who better to advocate, right? We look like our communities wherever we are. And who better to tell the story of the community? And so, I've been transfixed with, or obsessed, maybe I should say, with rural healthcare, because that's the community that I know, But yeah, that's exciting.
And it's stinks, like you said, access, especially with doctors either not wanting to move to a rural setting, right? In Minnesota, where I live, I know that's a challenge. Our state also suffers in the fact that we don't have the best scope of all the states. Like we're behind all of the, we're always trying to modernize our scope in our state because all the states surrounding us, I have doctors who I know that work in Minnesota part of the week and they work in Wisconsin part of the week, and they can literally cross a river and do way more than what they can do in Minnesota. And so that's possibly a barrier to new docs looking into, I don't know if I want to practice there.
100%. And, I was just asked to write an editorial about the doctor shortage. I'm like, well, the reason that we don't have what we need here in the rural Outer Banks is because it's not attractive for this particular specialty to move here. And we have a fairly broad scope of practice, but it's amongst the 50 choices that we have in the United States. We need more tools to take care of the patients that need us. I mean, literally, I have people walking across from the emergency room, as I said earlier, and from a federally qualified community health center, from primary care, patients of all ages, so I'm taking care of everything from a 3-year-old with type 1 diabetes with preseptal cellulitis to somebody that's got an orbital blowout, because they smashed their face skiing, because I happen to be in a ski area. So, challenged every day, grateful for my time covering the emergency room with the VA. Those guys and gals set me up well. And, I love it. I feel like I'm helping. I feel like I'm helping. And, I have other docs in the practice now, which is fantastic. And I think, we'll see. But yeah, the shortage it's real. And you need to have docs go to school. We train people for 8 years, plus residency, plus whatever other things that they're doing to improve their education. And they were like, well, wait a minute, we were just kidding. We're only going to let you do this. Who else does that in medicine? Nobody. Right. It doesn't exist. It's the weirdest thing ever. I mean, there are scope skirmishes, and we have a lot of team members in healthcare now, because I hate the term mid-level providers. What is that? Yeah. No, everybody's a team member. There are tons of physicians assistants and nurse practitioners, and they very much rely on, the above the neck eyeball sort of thing, in our community. But everyone's equal. It's the same in the hospital. The people that keep our hospitals clean, maybe they're even more important.
Well, I remember when I was doing my residency, and I would go to the ER, or not the ER, but the OR, and you'd observe the checklists, balances that they go through before an operation. And there is that, the training of like, hey, everybody needs to speak up if there's a problem. We double, triple check the date of birth, that we have the right patient, that we're operating in the right arm, the right eye, they're making sure everything
triple timeout, yeah.
Yeah, they're taking that time to make sure things are accurate, and it's everybody's responsibility to speak up if they see something wrong or if something needs to be fixed. It's not just the surgeon in the room. Exactly. It's not just the anesthesiologist or the higher degrees. It's like everybody needs to be on their game because you can't do it alone. And so that's just kind of that mindset. And I think that's overall making a shift and a change.
Yeah, I think so for sure.
It's just slow.
It's slow. And, that's why I talk about it, right? So when I want things to change, I talk about it a lot.
And that's that's honestly one of the reasons why I even wanted to start this podcast, is to give time to these issues, the struggles, because I know we have these conversations all the time at the pub, behind closed doors.
Right.
And I know there's tough topics politically and within our industry that some people get uneasy or frustrated with. Some people don't even want to talk about certain topics.
Right.
But I'm like, those are the topics we should be talking about. The fact that we're not giving air to it is the reason why it's a problem in the first place.
Yeah, and you're so right. And I'm so proud of you for that and for saying that out loud and making a formal effort to do that, because it's important. My focus at this point, I've done the lecture, I've lectured, I've been an educator, professor, all that fancy stuff.
Yeah, you've done a lot.
Yeah, but my focus at this point in my career is to talk to patients directly. One of the ways that I do that is to reject the 6-minute doctor office visit. I've refocused and realigned resources in our practice to make sure that I can maximize the personal conversations with my patients. I have older patients. I have largely Medicare-aged patients. There are days that go by when I don't see anybody under 80, and I love these people. And they need help, a lot of them. And a lot of times they just need help understanding what's going on with their aging body.
Yeah.
They need reassurance that, something really bad's not going to happen. They need reassurance that if they are losing their vision, that there's hope. And I'm going to talk about a project that I'm working on specifically in that regard. But a lot of it's reassurance. They expect you to be good at what you're doing and to know what you're doing. That's what the expectation is. And I'm proud to say, for anybody that's listening, your family eye doc, your local doctor of optometry. I mean, these guys and gals are badasses. They really know what they're doing. They're your go-to person for taking care of your eye health. They're your go-to person for helping you age in place. They're your go-to person for rehabilitating your vision. I mean, it's a wonderful, special profession. And I think that the public doesn't always know what we do in total. And, I said when we were talking before the interview that there was something that I wanted to share. And I'm going to read it. And I don't normally do this in an interview, but you say, oh, well, what inspires you? And I'm like, well, this letter kind of says it all. So this was written by a woman who at the time was probably my age, July 26, 1999. And it says, Dear Dr. Hitchmoth, I still get choked up when I'm going to read this letter because it's one of those things that I want everybody to know and feel. This letter is to personally thank you for the excellent care I received from you and your office staff, and to let you know how I'm doing. In May of this year, you might remember discovering a potentially life-threatening disease on the retina of my eye. One of your colleagues saw something of concern and referred me to you. I'm paraphrasing just a little bit here to keep her identity private.
Right.
Yeah,
we know that.
And you were right, and you diagnosed me that day with a cancerous melanoma on the retina of my eye. I have subsequently, and of course I knew this, undergone laser at the Wills Eye Hospital in Philadelphia, performed by Dr. Carol Shields. So she couldn't have been to somebody, the top of the top. And I'm back home in New Jersey. This disease could have caused me to lose my eye and can spread to the liver and lungs if untreated. Hopefully, so far, none of these things has happened because of the early detection. I hope you never find another person that has what I have, but I know I will be eternally grateful for you and your knowledge and the concern you have shown me. I know that it probably isn't every day that an eye doctor can say that you saved someone's life, but you can say it today. And I'm like, oh, but so I was so grateful that someone, and this is a typed letter from this amazing woman who was clearly so grateful, but
not even an email. They
no,
took the time to type
it was
it
1999. The things are different. Yeah, but she took the time to type this and put her signature on it, as you can see. And this is wonderful and amazing and great. And, it happened early in my career. And I had been in situations already where, you find the hole in horse plaque in the retina and you send someone for an echo, and the next thing you know, they're in the cardiac cath lab, a day or two later, right? We know that, but the public doesn't know that. And that's why I like to, that's the first time I've shared that since probably 1999.
Wow. Thank you for doing that. That's amazing.
I accidentally bumped into it in my crazy, Google Drive the other day looking for something else. And I'm like, wow, yeah, there's a reason I saved that. And it's so that the public knows that when you go to your eye doc, it's more than just this, as I said in the beginning. It's about, oh my God, did you know that you have like this little spot over here in the back of your eye? And do you have diabetes? Does anyone in your family have diabetes? What's going on with you? When's the last time you saw your primary care doctor? It is the window to the soul, as we all say, but it's a view into the body. And again, a privileged view, and something that we can use to talk about, use as an opportunity to talk about general health. So I'm a big prevention and wellness gal. I am on the executive board of the Ocular Nutrition and Wellness Society. And so we're a small sub-society under the umbrella of...
It's actually, I've been looking into the ocular nutrition. It's something I'm passionate about. And I'm looking to get involved, not only joining, but getting more involved and just learning to improve my own knowledge and skills.
And so that's what we do. So we educate other eye docs. We have the benefit, I think, of having a little bit more awareness about nutrition and prevention relative to other specialties, because we have the age-related eye disease studies that have been going on now for decades that say, hey, there's these vitamins over here that could like kick the can down the road on losing vision.
And it's part of our basically our requirement with diabetes that we give some level of education around lifestyle, diet, lifestyle, and how important blood sugar is.
Right.
And so that's one thing that kind of tipped me in that direction. I was like, what should I be saying? What does the science, the literature really say?
Exactly. So we share education that's evidence-based, and we also talk amongst ourselves about how to have maybe easy conversations, but not so easy conversations with patients. The reality is that we have a sugar addiction and obesity crisis in this country. And, I joke all the time, sugar causes blindness. What? Smoking causes blindness. There are things that people just need to be aware of if they want to save their vision. And, I'll repeat it until I'm dead, but vision loss is preventable. Vision loss is preventable. And I think...
I had Amanda Legg on the podcast in a previous episode who said basically the same exact thing, specifically about macular degeneration, which I know is another big thing for you. But it's amazing that so many, I think a lot of doctors are waking up to that, not just in optometry, but in other professions too.
Yeah. Mediterranean diet.
Except that's it. My thought is just that the problem is that we also need to better teach our patients that we hear Mediterranean diet. That does not mean you order a meat lover's pizza from Domino's. just because pizza's Italian and that's in the Mediterranean Peninsula doesn't mean that's the Mediterranean diet. And 100%. So that's a lot. That maybe we'll have a whole other episode just talking about nutrition or something.
I could go on and on about that, but that's exactly right. My mom's Italian, so I always have to give a shout out to my mom. But
she must know good food then.
Yeah, she totally knows good food, and it's the traditional keyword. And my
real food.
Yeah, and my dear late friend, Dr. Stuart Richard, he's like, it's the traditional Mediterranean diet. I'm like, yes, Stu, that's right. But we still need to educate people about that word.
Yeah.
So yeah, definitely a whole nother subject.
If you don't mind me sharing my story, similar to what you have in sharing that letter that you got from that patient, because
Please.
I think every doctor at least has one story, and the doctors who are maybe younger and feel like they don't have this yet, I'm like, you probably have, you just haven't either recognized it or you have one right around the corner. For me, I've had several, but one that I will never forget was a patient that she was young, early 20s. She was like 20 or 21. She was home from college, and she's just updating her contacts. That's it. During an exam, recognized Roth spots in her retina. Not just one, multiple. And this is a young, healthy female, no diabetes, no other health history, feels fine. And I'm like, this should not be here. This doesn't make sense. Ordered blood work. Well, I don't know, this doctor, I feel fine. And she never went. At first. She didn't go. Unfortunately, COVID happened that next week. So our clinic was shut down, chaos, no one knows what's going on. I wasn't in the clinic, so I didn't even get any letters or anything. So a few weeks after COVID kind of settled down, I at least got back to the clinic to look, just to kind of see what faxes and things were coming in. I didn't get anything, so I called her, didn't get an answer. Another week or two goes by. Finally called her again, got a hold of her. I'm like, whatever happened? I didn't get any notes. She just said, you saved my life. And I was like, wait, what? Because I still had no notes. And she just, she went on to say that later that week, she felt ill. She felt fatigued. Something didn't feel right. She actually went to the urgent ER care, and she brought my notes and my order. She brought my lab order.
Wow.
And so they did a blood draw, and then they triple checked her platelet levels. She had developed ITP, and her platelet levels were so low she could have bled out at any moment. So they admitted her to the ICU and she was in there for about a full week.
That's crazy.
And that was in the middle of the chaos of what was going on with COVID. Yeah. So she was in like a really tough spot at that time. But I think it's just another one of those things of, thankfully I know the AOA's just updated a really amazing recommendation now that we can stand firmly from a multidisciplinary stance that yearly eye exams are recommended and should be. And that's why I'm like, this person had just no other help, nothing else going on. Vision was great. Just wanted to update contacts, order new ones. And you can catch these sort of life-changing moments.
Yeah. So. Yeah. And you can't tell those stories enough.
Yeah.
And but there's thousands of these stories that we all have to share, and I love for the public to know that. But there's that I don't give a damn thing. I don't give a damn about the fact that you want to just update your glasses or update your contact lenses. Yeah. Like, the bottom line is, let someone look through your pupil. Get the proper exam. Like, go be cheap about something else. Like, skip the movies once. Does anyone go to the movies anymore? I don't know.
or Netflix or
whatever it is you're spending your money on.
The classic one is the $5 or now $7 coffee.
Yeah, like, skip something and pay attention to this. Like I was saying earlier, it's like, yeah, put that on your checklist of things to get done every year for your entire life. And that is not me promoting the profession. It's about these stories, right? You could have a clean bill of health every year. You could have a clean bill of health every year going to your internist. But it's an opportunity to check in. It's an opportunity to make sure things are okay. It's an opportunity to have a chat about what can I do to make sure things are good. And I encourage young people, when you're healthy, you don't think of this stuff, right? I'm in my 50s now, and I'm still like, okay, things are starting to get a little creepy around here.
Versus
hurts a little.
Versus the 17-year-old who thinks they're invincible.
Yeah,
and
invincible.
will never die.
Yeah. I mean, I thought I was, up until very recently, thought I was quite rather invincible. And, you don't think that things are going to go wrong. But, you can take action. And like I said, I'm all about the prevention. But I encourage young people to talk to their parents and their grandparents. I don't know why these conversations don't happen, but I also say to grandparents, talk to your kids. And I say this a lot to people with macular degeneration, right? So there's a strong genetic component in macular degeneration, but we have all this data, all this research that says you can kick the can down the road, right? So my mom is like 1 of 10. She's the 9th of 10. And I had the privilege of looking at about 8 out of the 10 retinas, if you will, people. And, everyone in my Italian family has macular degeneration or drusen in their retina. I have drusen in my retina.
How does that?
So that feels scary now.
Yeah. How does that, knowing what you know, what is that?
Yeah, I've always been a little bit of a health nut, but, it's helped me pay attention. But now I'm like, oh, wait a minute. So when I get the grandmothers in, I'm like, okay, you need to go and be the best educator in your family. So like I recruit the patients. I'm like, you have macular degeneration. You've just lost vision in one eye from this. Do any of your grandchildren smoke? Do they have this? Do they have that? How do they eat? I want you to go tell them that these are the 4 or 5 things that they can do and get their eyes checked regularly. Because even if you do, convert over to the more, severe form of macular degeneration, there's timeliness about that. I don't want to talk about specific products, but there is a product that you can prescribe that Medicare pays for, that patients can monitor their own vision at home for early detection when they have the disease. So at every stage of the disease, your family history, there's something that you can do to save that vision. I want people to know that.
And I think that definitely plays on our fear of people's fear of going blind. Like they would rather, a lot of people would say in a questionnaire of like, they would rather die than go blind. Lose
that's an arm, right?
Yeah,
exactly.
That's a real fear that people have. I have a friend who at least wrote a movie. He doesn't know if it'll sell or what, but his movie idea was that a photographer or who's going to go blind, he knows he's going to go blind in 1 year.
Yeah.
Like if you were told for certainty, like you have vision for 12 more months, that's it, and then you will be completely in darkness. Like what would you do in that year? What would you want to go see? But in many ways, like what would you pay to even get 1 more day of good vision? What would you give up? What would you do if you could extend that months, years? And so that's a big, in lifestyle changes, it's not just one little thing you do a day. It's like the long-term marathon of little things that stack up over time.
Yeah, that's exactly right. And, and like you said, those are topics to expand on, right? Because there's a lot that can be done. And, just talking about our sugar addiction, we could talk about that for an hour, just talking about the Mediterranean diet and blue light exposure and smoking, obesity, all those things. And, so the back end of that, I'm on the board of what used to be called the New Hampshire Association for the Blind. It's now called Future in Sight, which is probably a better name. But, if you do lose vision, there is hope. And it's organizations like the one that I serve on, that and your doctor of optometry who's a low vision rehabilitation specialist, or not, even just your regular person that you go to all the time. I mean, there's things that can be done with a simple pair of glasses that can get you from feeling like you're never going to be able to read again to read again. Just
with everybody should, from their standard schooling, should at least be able to know, and if they don't remember, they should be able to mathematically figure out how to prescribe a high-powered ad.
Yeah, like mag equal D over 4. Like that's all you have to know. For all these levels of early vision loss. But yeah, absolutely. And patient advocacy, educating the public, which is why I love what you do. so much because you're educating the public, and you're going to do this for a long time, and you're going to be successful, and it's going to be amazing. And you're going to save potentially thousands or millions of lives, right? Because you're just putting information out there for people to see. But one of the projects that I'm working on, I'm looking at my phone here in the interview because, that's what we do in life. But I was just asked to be in a documentary film, and it's a story about people who have lost vision and what their journey has been like. And so for anybody that might be listening that has macular degeneration, I want them to know that there's hope. And of course, that's the title of the film. So it's Losing Sight, Finding Hope, Living with Macular Degeneration. And it premieres next Tuesday on YouTube TV, which is super exciting.
I'm going to be checking it out.
Yeah.
I'm probably going to be doing a reaction review about it. It's going to be a good kind of, I think no matter what, just more exposure, more discussions, highlighting these are real things. I mean, I don't have macular degeneration in my family, but after, I think every doctor at some degree, because you've seen patients struggle with losing their sight in this way. When I see a young person in their 50s and I look in and I see soft drusen already, I'm like, shit, like this.
That's right.
And they may not get it, but I get it. And I have that fear. I'm a higher myope and I wear contacts the most time. And I'm just like, I am at a much higher risk of developing some sort of maculopathy, reduced vision, maybe macular degeneration as I get older. And I'm like, God, if I can do anything to preserve my own eyesight and other people's, like that's the best gift I can give. So
perfectly said. Yeah.
But I'm excited about your project. So it's releasing, you said, on YouTube TV. So it's going to be basically free for people to watch.
100% free.
Yeah. That's a big thing. Because I know other people have done documentaries, but it's behind a paywall.
Yeah.
And when it's a niche subject like this, it's a little, I think, more difficult for people to consider trying to get through that little paywall.
Yeah, and it's fully funded by the American Macular Degeneration Foundation. So,
Amazing.
every chance I get, to thank them and the people who give generously to that nonprofit. It's a beautiful, in my opinion, it's a beautiful story about how people persevere in the face of vision loss. And, there are a lot of things about what it's like every single day to live with vision loss and how you can overcome some of the challenges and still live a beautiful life.
Attitude is probably one of the most powerful things, because I think working with low vision, there's some people who at a young age, they'll lose their eyesight. Doesn't stop them. Maybe it's tragic. They spend some time, at really low part in their life, but there's some people who just switch gears. They go write a book, they make a movie, they start a business, it's maybe more challenging, but life doesn't end.
Absolutely. And there's some kind of staggering statistics around people who have either congenital blindness or lose their vision in their younger years. A lot of young folks, like 70 to 80%, end up on disability and without a career, without getting a specialty, without even maybe going to college. That's an awful statistic, and that's an awful lot of wasted, amazing perspective in the world and resources. And that's one of the foci for me. It's here I am, supposed to be some fancy neuroretina expert. I'm a retina society fellow, and I can identify all these diseases. Well, you know what, that's great, but when it comes to helping people, really, it's about helping them understand their value and how to navigate the low vision world. And I didn't start off in low vision. I do a little bit now. I'm in that world because of my nonprofit dedication, but really, that's what it's all about, is helping people understand that they have amazing gifts to give, and no matter what, there's always hope. I keep using that word because I love that word. Yeah.
Well, this has been an amazing conversation and a great opportunity, and thank you so much for just sharing so much of what drives you, your passion, some of your experiences. In one final little kind of reach out, like, you give a damn about your profession. You've been so involved. Outside of just patient advocacy, what really motivates you? Why do you love optometry? Why do you love what you do? What drives you to reach and succeed in so many avenues? Why do you give a damn?
Yeah, why do I give a damn? I give a damn because I am so grateful to be a woman living in this century, in this country.
Oh, that's a whole other topic. That's a whole other episode right there.
And, how dare I not take advantage of everything that's around me?
That's powerful.
It is. Mm-hmm. And, these two little redheaded grandchildren, they're pretty motivating too.
That's got to be a beautiful family photo.
Oh, yeah. No, your family motivates you. The love around you motivates you. The desire to help people motivates you. It's just a wonderful life. I grew up all around the world because my father was career military, and I learned a lot from that. That was a gift. And I'm glad to be here, in beautiful New York City, talking to you about how to help people.
It's a gift, right? Every day.
It's a gift. Yeah.
Thank you so much, Dorothy, for being here. This has been great.
My pleasure.